I think the important distinctions are migraine is a moderate to severe pain, and tension type headache by definition is a mild to moderate pain. So one of the key things that teachings will be that if a young person is seeking a intervention from a health professional for a headache problem, it's more likely than not a migraine rather than a tension type headache. Yes, tension type headache can also become very problematic, but the probability of someone having a migraine and seeking medical intervention is probably quite high. So I think one needs to remember that. The second thing really is actually in children, it's almost always bilateral headache rather than a unilateral headache compared to adults. And the headache, the time, length of the headache can actually be as short. It can be as short as an hour, sometimes even shorter. And a lot of the time, some of the symptoms that are required to make the diagnosis, whether it is photophobia, phonophobia, movement sensitivity, all of these can be inferred rather than volunteered. So sometimes in the younger age group, they might not have the vocabulary to articulate exactly the symptoms. So one has to use other methods of getting their history, whether it is drawing, whether it's gestures. And mostly, I do think that if one were to listen very carefully and observe behaviors of a young child during a headache attack, that probably gives away the diagnosis.